right, you guys ready? Yeah, this is a very interesting forum. So I think you guys are good for choosing Hall 1 instead of Hall 2. I was in Hall 2 yesterday, no one there. Very sad. Okay, so I'm very glad that we get three distinguished speakers here on the stage with me right here. So my name is Jason, I'm with HIMSS. And on the stage here today, we have Dr. Lee Hui Mei, we have Dr. Raymond Choi, and we have Dr. Prataban Raju. Now, all three of them has been deeply involved in digital health technologies. So what I'm going to do now is I'm going to go ahead and let each and every one of them to introduce yourselves, and please explain a little bit what you guys do on your day-to-day work. Right, Dr. Lee?
Thank you so much, Jason. So I'm Dr. Lee, but I go by Hui Mei. So I'm currently work as a BD and strategy as well as a development officer in MH Nexus, which is a local grown IT and software company. So my company actually, we do the health interoperability exchange platform, and its core business is in delving into developing health interoperability solutions. So my role in my company actually very deeply involved in two different aspects. One will be the business aspect of it. How do we find develop the business pipeline along health interoperability by engaging different stakeholders on the health system, right? My second aspect will be more on the technical base. So I work very closely with my technical team in terms of product development.
Thank you for that. So I think there's a couple of big words here called interoperability. I'm going to ask her more about it. So while you guys are there, please be prepared with your Slido. We'll get some of the questions answered. Right, Raymond?
Hi, good morning, everyone. Thanks, Jason. My name is Raymond. I'm also, like most of you, a medical practitioner by practice, but no longer practicing for a couple of years. I'm the co-founder and CEO of X1 Medical Group, where we are the hybrid medical group integrating and incorporating the primary and secondary care, leveraging on technology and transforming the way we actually deliver healthcare, looking into the area of the GP, dentals, wellness, anti-aging, as well as secondary care, specialized services, right? And of course, a bit of my background, I have a little bit of experience in running, a telemedicine platform called Doctors in Malaysia, where we actually, provide online consultation as well as electronic prescription in Malaysia. Yeah, that's me. Nice to meet everyone. Thank you.
All right, Dr. Prataban.
Hi, my name is Prataban. I'm a medical doctor as well. Currently, I run a training and consultancy company. We advise people how to build their digital healthcare platforms, help with business process engineering and things like that. We also do training for various things. And from a practice perspective, I run a clinic called GP Clinic, which is a digital-first primary healthcare practice in Petaling Jaya.
All right, thank you. All right, before I begin, just a quick show of hands. How many of you here has used telehealth platform before? Either whether you are a provider or whether you're a patient. How many of you here has actually ever used an online platform? Okay, 5%, okay, yourself. All right, so we're gonna begin with that. So if you look at the team right there as well, so can a doctor actually relax on the beach and look at patients? So probably first question to you, Dr. Lee, where do you see healthcare is going in terms of how the services are changing in the future, or probably right now? And
yeah, thanks. So I think healthcare, in terms of healthcare, I think in terms of the digital revolution, right? All the technologies are becoming more integral part of our modern healthcare delivery. And with the age of information technology, huge access to it, along with, if you have smart automation, you have smart assistants and you have your generative AI, ChatGPT. So as providers and doctors, we are definitely seeing the changes in the way we deliver them, and as well the changes in the health services aspect. So the most prominent one, I would say, is the doctor-patient relationship, right? Because with access to information, you have your patient coming in, you're on the phone already, all the online information, and they probably have the diagnosis in your mind. I'm coming in, this is the things that I know about my potential diagnosis, what's the treatment I might want to do. So I think from the doctor perspective, the challenge there is to how to manage the expectation of the patient, as well as to deliver evidence-based care. So how I think the future is how to transition of a role of a clinician from solely as a primary caregiver more towards becoming more of a health educator as well as a health coordinator. Because we no longer, as a doctor, in this age, we no longer can just dictate care, so do as I say, right? So it's more like working with the patient to come up with a healthcare plan alongside them as a health coordinator, and also to educate them on the various information that they gather. It's like how to sift through them and what is correct, what is a false myth, and so on and so forth.
So in summary, the digital health tools will actually enable all this to be possible,
Yeah.
in a faster and more efficient way. Is that correct?
Yeah.
Yeah. Okay. So Raymond, I understand that you have been, involved in providing services over telemedicine. So do you think that some of your providers are actually relaxing at the beach while they are consulting their patients? What are your thoughts on that?
Actually, I think for telehealth itself, I don't think any virtual doctors are any less occupied than the physical doctors in today's world, at least in Malaysia, because it's still a very green area, very new area, right? So, for example, the virtual doctors actually, they are seeing easily about 10 to 20 patients on average per hour online, right? And some even can go up to 50 patients, right? And with all the assisted tools and all this, right? So definitely they are not sitting by the beach side and to enjoy, right? But of course it also depends on the infrastructure readiness and how advanced are we in terms of the AI capabilities, assisting the doctors to actually practice more efficiently. I think we're still in a very, very early stage, at least in Malaysia, right? Going back to your question, right, that what's the future like in healthcare? I think, I just got down from Penang today, right, and I realized my message data actually, reached the limit, and I was panicked because there's no more data, right, and I was trying to hail a taxi, right, all this while we'll be using Grab, and I realized that, we are very much dependent on all the digital, tools, right? And 10 years ago, without, all the ride-hailing apps, I think we were okay, right? Today, you got panic, I got panic without data, right? You'll be very nervous if you lose your phone, right? More nervous than you losing your IC, right? Or even your passport. So, and, you look at fintech, right? All your digital banks and the ride-hailings and all this. We see the healthcare will be going towards that, but it's a matter of how fast are we able to reach that. Like it or not, our industry is still very least disrupted and innovated compared to others due to the fact that, we are heavily regulated and we are dealing with the health and safety of our dear patients, right? And there's so much of legacy, policies, governance in place, which is the right thing to have. But I think in terms of digitalization, I think there's still a lot of way to catch up for our policy. There's no way policy can actually catch up, but it's a way that how can we actually work with the policies, right? Work around it and to ensure that we are not compromising the health and safety of our patients. But think about it, right? And healthcare will be like our ride-hailing. Healthcare will be like our digital banking, our fintech industry. It's a matter of time. It's a way to go, right? That's how I see it. Yeah.
Okay. All right. Dr. Prataban, just a quick one, because I remember you providing access to patients to actually get, to request for medical services online, right? So that was a couple of years ago already. So where do you see that going further, or what's the future like from there?
Well, I think we've come quite a long way from then. Previously, we used to decentralize care back to patients' homes. With the first service, I opened door-to-door doctor. And I guess the pandemic kind of shook all of us up. And to the question, can you teleconsult on the beach? Technically, yes. All right, but I remember while we were onboarding doctors to teleconsult during the pandemic, and these were largely specialist doctors from a few hospitals, right? I guess the fundamental bits of, your doctor's conduct in front of a patient were not really translated from their clinical practice into how they digitally interact with patients, right? And I'm coming from a perspective, right? Do you have the right audio, or is the room quiet enough? Do you have a microphone and headset? Is your lighting accurate? Are you sitting with a backdrop, where there is a door, it's a piece of, so these kind of things in a clinical setting we think of, when a patient walks into our clinic, we want everything to look nice, but we kind of like stop short when we are doing something online, and I think that is where it will be challenging to provide a teleconsultation on the beach lah. You can't possibly be in your bikini and even though everything is perfect environment and all those kind of things, I think you would be on the wrong platform for that one lah. But I would say that coming back to the topic of how doctors can navigate digital healthcare, I wanted to say that I think doctors will be spending a lot of time on the beach, because I believe I'm going to say something very controversial here, right? I'm gonna go out on a limb and say that in the future, I think a lot of tele-primary care will be powered by artificial intelligence. Okay, and this may not be in our what we want, but I believe that market dynamics, and also more important things like equity of care. Can you imagine how many people you could reach, okay, with the technologies as well? So there's going to be a lot of controversial arguments going on, but definitely I would like to spend more time on the beach.
Okay, so basically the experience that a patient should get, even though it's online, even it's on a tele platform, it should reflect and should be similar to the real life consultation. I mean, that's essential, right?
There's a doctor's code of conduct.
Yeah.
It speaks about professionalism and things like that. I don't think we should forget those things just because it's a screen.
Yeah. So you bring that to the online platform, right?
Absolutely.
Yeah. Okay. No. So what I'm going to do is, Dr. Lee, you mentioned interoperability in the start of your introduction. So I'm just curious. The digital platforms, currently the space is so fragmented. When I say fragmented here, basically means that there are so many different kinds of platforms and systems and all. Now, you see, the challenge is even healthcare systems itself is already fragmented. And now you have platforms which are also being fragmented and all. So where do you see, so why is interoperability important, and how do you think we, as platform providers, can move forward to achieve interoperability?
Okay, I'll take on that. Yeah. So actually, we probably echo back from where Dr. Prataban left off, right, in terms of going back to the doctor's principle. So the doctor's principle, and technically what we want to do is deliver safe care, safe patient care, to the safe patient, to the correct patient, to our best ability. So I think throughout the entire conference also, we realized that AI, technologies and all, they come as adjuncts. So in terms of designing and coming out with a solution, digital solution, it will fall back to the same principle as a doctor. How do the AI or technology, the design principle in a sense, serve the best interest of the doctor in providing patient safety? How do we use interoperability to encourage and enable collaboration between different stakeholders, members of treating team, and also bringing together all the information gathered, what we call, I think, the terminology that's been going on lately, the lifetime health record.